Dr. Emily, nice to meet you.
Hi, nice to see you.
Thank you so much. How do you say your last name?
It's Splickle.
Okay, Splickle. Awesome.
Yes.
So I want to just give your credentials because I want everyone to
Yeah,
know who you are. But I'm really excited to talk to you because I talk about so many other things regarding women's health, but I think we kind of forget about the feet, but they're super important.
they are.
So are, you're a functional podiatrist. I'm going to read this from your email. And human movement specialist. You're the founder of EBFA Global, author of Barefoot Strong, and CEO and founder of Naboso Technology. Did I say that right?
You did.
Awesome. With over 23 years in the fitness industry, which is great, you have dedicated your medical career towards studying postural alignment and human movement as it relates to barefoot science, foot to core integration, and sensory integration. And I came across your page and I was so intrigued just because as a woman myself, and yes, I have a bunion on my right foot, and it doesn't bother me, but I try to take good care of it. But I think it's important to talk about that because a lot of people suffer from bunions. You certainly see it come across Instagram enough.
You do.
And I want you to just talk a little bit in general first about why foot health is so important, and what kind of issues you see in your practice.
Yeah, absolutely. So I actually do want to preempt this by saying that I actually approach feet a little bit different than probably a lot of podiatrists that maybe some of the listeners have gone to and heard that they just think supportive shoes, surgery, and orthotics. I look at the body very integrated. That's part of the bio that you had read, and a lot of that is because of my fitness and my movement background. So when I think about a bunion, I
Mhm.
am thinking like bigger picture effect on movement, stability, hip strength, how we walk, how we generate force, not just the aesthetics or the cosmetic aspect of a bunion. But feet in general, really, really important to our body's foundation. It's the foundation to our posture. So, how we stand, how we move is really initially dictated by that foundation. And then our feet play a very important role in stability, how we get into our pelvic floor, into our glutes. And then there are thousands of nerves in the bottom of the feet, which is my favorite part of the feet, is that sensory side.
Okay. And talk a little bit about your opinion on foot surgery because I have several friends lately that have had bunion foot surgery, and a lot of them have said it went well, and but then you talk to people who say don't ever do it, it's awful. So what is your opinion on it? Is it necessary, or are there times when yeah, you absolutely need to do some kind of corrective surgery, and does it last?
Yeah, so I was trained as a surgeon. That's actually required. I'm East Coast trained, trained in New York and did my residency in New York City. Um, Being trained as a surgeon and having done surgery for 5 years gives me this perspective of what I will share, my recommendations. I no longer do surgery because I shifted my practice to be more functional and regenerative podiatry. But I understand both lens. So there is a time and place for surgery. Bunions cannot be reversed without surgery. Just understand that, right? The decision to have surgery is based off of what I often say is the transfer effect on the rest of the body. Maybe you have such a limitation in range of motion that you are compensating the way that you're walking. You're starting to actually inhibit your glutes because you're not taking long enough steps because you can't, because you don't have the range of motion. Or it could be pain. Usually, those are the two most common ones: transfer stress and pain. So, time and place for it. When a patient does kind of sit there and make this decision, and I had a patient yesterday that I was talking about this, is it's really based off of what your x-ray looks like and what the health of that cartilage is. Because there's an appropriate time to do certain procedures, and then if you wait too long, well, you can't do those procedures anymore because there's not enough cartilage. So now you're doing a little bit more aggressive procedures. So that's something that you want to consider in it as well. Now, one thing that I'm a big believer, I think maybe it's because East Coast trained, but we were very into what's called a lapidus. That is a midfoot, essentially a fusion. The surgery is done more in the middle of the foot versus at the toe. It's a little bit more technically involved. But when you ever hear horror stories about someone had bunions and their bunions came back, typically that means that they had a isolated head procedure. They didn't have this lapidus or this fusion at the midfoot and really where a bunion is. So the appropriateness of the procedure will dictate that. And if you do a lapidus, your bunion cannot come back. It's impossible because the metatarsal is fused, so it cannot swing out
And
again.
then if it's fused, does that limit your range of motion?
Not at the big toe. So
Okay.
it's fusing it at the midfoot in a way that I tell patients you are not going to really understand or feel the effect of this in a negative way. And being a functional podiatrist, I stand very proudly behind like building confidence for a patient that that fusion, if it was my foot, I would go after the lapidus versus a head procedure because of that.
Okay. And then how do you handle someone if someone comes into you and say they have a bunion on their foot, but it not does not necessarily bother them as long as they wear, wide shoes.
Mhm.
I'm really big on wearing very low profile sneakers, and I want
Yep.
to talk about that for sure. I don't want to miss that one because there's so many different types of sneakers. I see my clients come in now when we're training that
Mhm.
they're not stable in, but like the low profile, like a Vivo or some sort of a cross trainer that's a little bit lower. What do you tell them to do as far as how to take care of it if they don't want to do surgery because it's not bothering them? But
Yep.
it is kind of ugly. But what are you gonna do?
Yeah. So if we have someone, or I'm seeing someone who wants to prevent a bunion,
Yep.
or like you're saying, they're like, absolutely not, will not have surgery. No, no, no. Not a problem. Okay. I'm going to give you the skills and the practices to hopefully push pause on the progression of the bunion. We can't reverse bunions, that's the surgery. But can we put pause on the bunion so it doesn't progress? And just so I can add, what progresses bunions is movement. So every time you walk your 5,000, 10,000, 20,000 steps a day, your bunion is progressing unless you're doing something
Okay.
such as toe spacers.
Okay.
So toe spacers is one. I knew you were going to ask about that, but toe spacers is one way. There's obviously bunion splints. There's single toe spacers. So instead of it being all five, it's just the one
Okay.
that you could put on. And essentially it is trying to create a more ideal alignment of the joint surfaces so that when you walk, you are not denuding your cartilage, right? Because our goal, if you have a bunion and you're not going to do the surgery, we want to prevent it, is to really protect your cartilage. That's where my mind goes. So there's that. You want to obviously release the foot, the muscles in the bottom of the foot. You want good ankle mobility. If you have a flat foot, a pronated foot, you may want to use arch supports. I'm a huge advocate, of strengthening the foot. So getting the intrinsic muscles of the foot strong. I teach a lot of my patients how to essentially center their base, how to find neutral, how to activate their intrinsics, how to strengthen the foot, use those toe spacers, release your feet every night. And we're essentially doing things like that. Avoid high heels and shoes that are going to push it in. You could add that as well. So it's about changing our lifestyle and incorporating these small little habits to then push pause on the progression of the bunion.
Okay. That's good to know. So then what does a woman like yourself or myself or anybody else listening to this wear if you're wearing a nice fitted dress and you want to wear, you know, a shoe that makes your leg look nice, it goes with your outfit without wearing something that looks a little bit, older kind of looking shoe? Like, are there brands out there of shoes that a woman can wear with a dress or something so when she dresses up, it doesn't look like she's now wearing like a sneaker or something?
Yeah. So I actually work with various different brands that do have more foot-friendly heels. They're not going to be as stilettos, not your Manolos, right? But there is something that is more favorable in that direction. The brands are Aetrex, Aetrex. Orthofeet is another one. Of course, you have some of the other ones. Michael Kors does some good ones. I actually really like Coaches. Coaches have a friendlier shape.
Okay.
What you can also do is look for either kind of like an open toed or a sandal, obviously respective of the weather. Look for fabrics that are more forgiving, so they will actually widen with the foot. And then if you have to, let's say push comes to shove, you're somehow in front of people that you have to be in a shoe that is just a little bit not bunion favorable,
Mhm.
is just know it's a moment in time. Get into, I call it stiletto recovery. Do what you're going to do when you're out of the shoe and know that it was a moment in time. The rest of the time you are in these healthier, these foot friendly shoes, and just stay with that.
Okay, that's great advice. Have you heard of a shoe company called Vionic?
Yes, they are another one.
Yeah, they're pretty good. I actually just stumbled across them about a couple of months ago when I was in Nordstrom and
Yep.
put them on. And she was like, "Oh, she's like, this will be great. Don't worry, try it." And I put it on. I'm like, "Oh my god, these are really nice looking shoes, and they're so comfortable." So I bought
Yep.
two pair because now
Yep.
and they make some other really nice styles. They have some nice boots. So it's like, wow, now it opens up. There's actually some options so you can still look fashionable without, wearing something that just is. I mean, I look at still, I love high heels. I used to wear them all the time. I walked around New York City in them, which is no wonder why I have a bunion. But, I look at those shoes now and I'm like, oh my God, I get pains just looking at them on the display.
Yes, yes. But yes, Vionic is one. And honestly, if you start searching on the internet, because there's a lot of different brands and like HX Vionic, some of these, it'll start to get you in this category.
Mhm.
They used to be referred to as orthopedic shoes,
Right,
but they're just more foot friendly. And a lot of these companies, just because I work with a lot of them, actually are bringing in really good designers and they understand that they're looking to appeal to a younger demographic. So they have to push the envelope a little bit as far as the fashion
right.
that they're pushing across with it as well.
But I have also noticed too some of the companies because once, like with anything, you look something up on the internet, then you're just the plethora of ads that come through for whatever it is. That's a little creepy, but there are
Yes.
companies that I'll get their Instagrams come across and the shoes like you said the fabric is stretchy
Yep.
and they'll say good for people with bunions. I think aerosols is another one. I haven't actually tried them, but they look like they may be a little bit foot friendly
Yep.
also. I'm curious though, when you're out and about doing stuff and you see people like walking around in, stilettos and super high heels with very pointy boots and things like
hmm
that. As a podiatrist, do you look at that and go, ooh, do you cringe or like,
The funny thing is that not a lot of people know this about my history. So I used to have a program called Catwalk Confidence. This is when I first started my career. So I was about 30, kind of around that, in New York City practicing. This was more the days of Sex
yeah,
in the City, not athleisure, Lululemon. So it was totally different. And I had a program around stiletto recovery and understood that women were wearing these heels, and women still wear the heels. Obviously, Manolo and all of them are still in business. But my focus on that, instead of shaming them or giving them my
yeah,
business card, is to say, how can I educate people, kind of like the conversation that we're having, that if you have to wear them because you have a wedding or an event, I get it,
right.
right? Plus they're gorgeous. I love the design of stilettos. I
I
just
know.
think they're beautiful. They're like art. Is what can we do when we get out of them? How do you keep your feet strong? How do you keep them healthy? We understand the impact that they have on the body, the lower back, the knees. So you can't be wearing them every day. Or if you do, just understand the effect it will be having on your body, right? So it's about that balance.
Okay. And just to switch gears a little bit now too, I noticed on your Instagram you have a picture working out barefoot.
hmm
I'll do that also. I'll work out in my socks. Talk a little bit about why you like that, either in your socks or barefoot or wearing like a Vivo kind of shoe. Like, talk a little bit about that. And then I do want to address some of the other sneakers we see, like Hoka's and some of the other brands that have the
Yep.
super chunky heels. Like, are those sneakers, are they good for you for something else, but not lifting or not at all? I'm curious because you hear a lot of things people say, don't ever wear those kind of sneakers, but a lot of people, a lot of my clients that come into the gym are like, my foot doctor told me to wear these. So,
Yes. So, in an ideal, perfect world, I would love to have people in as minimal, naturally, freely movable shoe as possible, which would be something like a Vivo Barefoot, a Zero Shoe, a Lems,
mhm,
something like that, which means that you can take the shoe, fold it, twist it, move it. It has minimal to no cushion, minimal to no drop. So, you get maximum stimulation and range of motion of your foot during your movement. We're talking about the gym here.
Right.
So when you're doing squats, lifts, etc., if you can get as much stimulation and activation of your foot, that is ideal. That would be minimal shoes. I like to go even more minimal, which would be truly barefoot, because I really want to activate the digits. And the strength of the foot really is within the toes. So if you can learn to anchor your digits and connect your toes to your pelvic floor when you're doing something like a squat or a deadlift or even a bicep curl, you really stabilize your center from your toes up, you will notice that you are much more stable and therefore much stronger. So that's where I like to do it. Now, in the real world, this is where you can start to pull a little bit away from these minimal shoes because people have flat feet,
Right.
plantar fasciitis, bunions, neuromas, whatever it is that they're presenting with. And then it's the day-to-day stress, the walking around the city, whatever it is, that's really where the foot is being worn down and what's causing these symptoms. So that's where you could look at, okay, do I use an orthotic? Do I use a more structured shoe? Do I look at something like a Hoka, where a Hoka is a maximal shoe with a rocker in it? And what's supporting that rocker is a carbon fiber plate that is in the shoe. Now, I recommend Hoka sometimes to
Okay.
patients. And the reason I will give the most common reason that I recommend it is arthritis in the big
Okay.
toe with limited range of motion. So they do not have enough dorsiflexion in their big toe to extend it, which means they cannot bring their leg behind them and take a long step, extend the hip, dorsiflex the toe to get a nice stride. That's not possible because of their toe range of motion. So what's happening is they lock up their foot, their ankle, their pelvis, their T-spine, and then they start to get all this transfer stress. That would be an example where the benefits of Hoka and cushion and just all the features of the shoe outweighs the negative of that shoe, because I'm looking also globally at the whole body, and I can't just be thinking of my belief in minimal shoes when I understand the effect it's having on someone globally to their musculoskeletal system.
Can you also address a little bit about plantar fasciitis and some of the best ways to help that feel better, get it to go away? I had that when I was pregnant the first time, and I went to my foot doctor, and he's like, "I can't do anything for you because you're pregnant. I can't do much." It went away on its own, and it never came back, thank goodness. But
Yeah.
it is also, I have experienced it, and I know when people say they have it, and just in some of my readings and research, I've read that you should be more, closer to the floor, barefoot, walking around. But I know it can be very, very painful to do that. So
Mhm.
can you address like how you would talk to one of your patients if they came in, and what the protocol would be?
Yes. So your plantar fascia, which is the thick band of connective tissue on the bottom of the foot. So we have this plantar fascia here, is kind of like a rubber band. And every time we walk, your arch actually compresses. So arch compression, this widening of your foot, is just a normal part of how we load and unload energy. Depending on your foot type, the activity, the load, whatever it is, you may overload this rubber band or this loading and unloading through arch compression when we walk. And then what happens is you start to micro tear or micro injure the plantar fascia, the rubber band, which then creates an injury response. Your body repairs it with inefficient collagen. It's kind of much more complex than it. But essentially, what it is then you're presenting with this inability to stand without pain or move dynamically without that sharp pain. A big part of how I introduce plantar fasciitis or plantar fascial symptoms, especially in this, because there's not a lot of peripheral context, is I try to just get control of the situation. I put all of my patients on a 2-week protocol where I call it putting out the fire. And I am bringing support to the foot, supportive shoes, arch supports. And also during this time, we cannot pass judgment in any of these things. So if you're using arch supports and you don't believe in arch supports, It's in a 2-week window, no judgment. I'm trying to get control of the situation. So we're doing support. We are minimizing stress. So no running, no jumping, nothing ballistic. If you use a standing desk, I need you to sit down. If you walk your dog every night, I need you to minimize that. Whatever it is, we have to minimize stress. 2, you're doing focused self-myofascial release. Release the bottom of the foot, but not where you have pain. Release your calves, very, very important. And oftentimes releasing the pelvic floor because that ties into your foot as well. And then the fourth one is I like systemic enzymes. They're naturally anti-fibrolytic. You could do something else. You could do Icene, you could do Advil, Aleve, Motrin. And again, we're not passing judgment on is plantar fasciitis inflammatory, not inflammatory. There's this whole debate around it. We are doing essentially this standardized 4-step, 2-week, consistently every day. And I'm just trying to see the way that your body responds to that protocol. If you came into me as an 8 out of 10 pain, and we do this for 2 weeks and you're a 4 out of 10, that's actually what you want to see, right? You got a 50% improvement. This is exactly what I want to see. If you came in as an 8 out of 10 and you're still an 8 out of 10 and you were being awesome about these steps, well, now I have to look a little bit further. Obviously, there's deeper history. I might get some imaging. I might start to think that we actually have some degeneration going on. So I then navigate these patients a little bit different.
Okay, that makes sense. And then what would you say, in your opinion, are the top maybe 3 things that anyone listening to this or that will listen to this can do for foot health? Like you should do these three things every day.
Yes. First one would be release the 26 muscles in the bottom of the feet. Use a golf ball, a cross ball. We are totally biased. Here's our neural ball. It's a dome that you would stand on. Release the feet and get those muscles, just give them a little bit of TLC, and it also supports circulation to them. So that's the first one. Second one, honestly, it would be something like toe spacers. Toe spacers are one of the easiest ways to stretch, open up, and reverse the effect of footwear. It's so easy. You just walk around, cook
Yep.
dinner, read, do it before you go to bed. So easy. That would be the second. The third would be to actually wake up your foot muscles. And one of the easiest ways to wake up your foot muscles is by doing balance exercises. So standing on one leg, balancing, do it barefoot, 10 seconds per side. Do just a couple times per side if you want to brush your teeth standing on one leg. There's all these different ways that you can incorporate it,
Mm-hmm.
but it is so powerful to wake up the muscles of the foot. And just remember, the strength of the foot is in your toes. That is what we're going after.
And then, so the first one on the ball, you rolling your foot? Are you rolling your foot on the ball?
Yeah, so you're standing. So this is actually a ball. So it's a
Okay.
ball if it's closed that you split it and it's 2
Okay.
pieces. So now you're on 2 domes and you're just standing. So it's pinpoint pressure.
Okay.
Much better release than rolling on a golf ball is to stand
Okay.
pinpoint pressure.
Okay.
Yeah.
Great. And then toe spacers, would you sleep in them too, or just wear them around the house? And would you wear them in your shoes if you could make it all fit? Because sometimes it's a lot if you're wearing a sock and it's toe spacers, and then you're trying to get into your shoe.
Yeah, so depending on the style of the toe spacers, so one like this style is what we have at Naboso. There's of course other ones on Amazon, but toe spacers, this style you can wear in your shoes, walking around, working out all day, every day if you want. Some other ones like yoga toes, just as an example, is a very, very bulky one. It is not intended to be walked around in. So you just wear it sitting down, recovery, reading a book, watching TV, etc. I tell people if you can get at least 15 minutes a day in the toe spacers, then that's your minimum that you're wanting. You don't have to sleep in them. It kind of reminds me of like night splints when people have plantar fasciitis, and the patient is always like, halfway throughout the night, I had to kick the stupid thing off. I
Right.
get it. You probably would kick this off after a certain point because your mind just wants to disengage and go to sleep. So you don't have to wear them sleeping. There's not an added benefit of wearing them
Okay.
sleeping. I would actually rather you wear them in your
Mhm.
shoes than in bed because what progresses bunions and what restricts and creates a lot of the dysfunction in the foot is when you're walking around.
Okay. I know, and I've tried to wear mine to sleep, and they just get it's like you can't slide your foot around in the bed. It gets
Yeah.
stuck on the sheets and
Yeah. I get it.
these problems. But
Yes.
that was now. Do you work with people virtually? So if I want to call you and say, "Hey, let's look at my foot. I want to make sure that I'm taking good, proper care of it."
I do, yes. Actually, a majority of my patients are virtual. And I think part of that is obviously COVID demonstrated telemedicine is
Yeah.
great. But I also practice in a very unique way as a functional podiatrist versus traditional podiatry. A lot of the patients I see have seen a lot of other providers, and they're a little like, or they want to get a different perspective outside of the box. Maybe they appreciate that functional side. People can, creep all over my Instagram and
Right.
YouTube and see that I put a lot of content out there to educate and to show that I approach patients in a very different way. I'm what's called direct care, so I'm not under insurance. So I see a patient for an hour. So I get a full understanding of your picture, and then I give personalized treatments to every
Okay.
patient.
That's great. So they can just go to your Instagram channel. Is it the functional
Yep.
thing?
The Functional Foot Doc. Everything links to YouTube. I have a book called Barefoot Strong, and it's
Okay.
available on Amazon. Really, really easy read of how to just start the habit of healthy feet. I try to make it approachable for all ages, everyone. And then obviously there's Naboso, my practice, YouTube. I have hundreds of videos on YouTube. I share a lot of
This is
content.
great. And I have one more quick question, and then
Yeah.
I'll let you get back to work. What about foot reflexology massage, where they sort of get in between each bone and in between the toes? And I had that done once, and it was, I can't believe how incredibly painful it was. It was. I'm like, I never realized how much stress your feet hold and how tight they are.
Yes. So I absolutely love foot reflexology. Now, I'm not trained in it. I travel a lot to Asia for work. So I've had foot reflexology from every aspect of Eastern medicine and how they approach it a little bit different. And then I've had Western trained reflexology. I absolutely love it. I do recommend it to patients. I'm a big believer also in acupuncture and dry needling. So I'm very much in favor of all of that.
Okay.
Recommend it. Again, I don't provide it because I'm not trained in it.
Okay. Awesome. That was great, Dr. Emily. I really appreciate your
Thank
time.
you.
I'm so glad I came across your page.
Yes.
This is fabulous. And I will post
Sure.
it and put you in there so you can be a collaborator so everybody else can watch this. But this was very, very good information. We forget about our feet. We think about anything else, but I think, and we really need them. Without your feet, you're not going anywhere.
I know, I know. Thank you so much for the opportunity to share. It was a pleasure. We'll do it
Thank you.
again.
Have a great day.
Thank you.
Bye.